So will your LED mask, your red light, your panel, your red light wand, will it harm your eyes? Because inevitably, you might be getting some red light into your eyes. Today, I'm going to tell you exactly the answer to that. I'm going to look at some research. I think you're going to be absolutely shocked at the research going on for red light therapy benefits, but there is one practice that people are doing with red light that's, in my opinion, very harmful and that you need to know about. And if you're in the United States, you'll be upset with this. Look at this. First treatment for macular degeneration now available in UK, but it gets worse. Look at this. After successful trials in the US, a light therapy treatment is now available in Britain for those with macular degeneration. The trials are even done in the United States, but it's not approved here yet. A huge problem, and we don't have it available or FDA approved, at least in this country. So yes, you'll probably be surprised in this video. And look at this one. Morning exposure to deep red light improves declining eyesight. Just 3 minutes of exposure to deep red light once a week, just once a week, when delivered in the morning, can significantly improve declining eyesight, finds a pioneering study by UCL researchers. Eyesight and visual acuity is a huge market. Many people have eyesight that's not perfect. Now, to understand this, we first need to know how exactly does red light work? What's it doing? Well, one of the main functions, especially for aesthetics, is it boosts your ATP, your energy in your cell, by boosting that mitochondria, the powerhouse of your cell. And in turn, it's boosting what's called the cells that are called your fibroblast. And the fibroblast produces two main things: collagen, which makes up 90% of the supportive fibers, and elastin, which makes up 10% of the supportive fibers of your face to hold it up. But this accounts for other cells, and that's why people use it, red light in general, for muscle aches and pains, and what we're going to talk about today, the area around and in the eye, because that's the powerhouse for all your cells. Helps decrease inflammation, decrease oxidative stress in your body and your cells, and something we often talk about when we talk about PRF, or all natural blood draw, injections into the face and for aesthetics, and that is your growth factors, which are signals within the body. So those are the four main ways that red light works. It's important to note here that there are different wavelengths. Most masks are going to be 630 and 830 nanometers in wavelength. The longer wavelength, the deeper it absorbs. So when we're talking about going to the data on the eye, keep that in mind. Now let's first talk about the effects on dry eye. Let's look at this study here. Now I'm going to share some studies today, and I know some of you don't like the deep dive. Just hover below. I placed chapters like I do in all my videos so you can skip the sections you don't want to see. But many of you, I know, commented you like the deep dives. My goal is not to waste your time. And dry eye, so many of you have this. Look at this, the effect of low-level light therapy, that's LEDs, in patients with dry eye. And this was, in fact, a prospective, randomized, observer masked trial. So pretty good. And for dry eye, you can see the mean difference of score. So they scored the eyes on a couple different levels for dry eye. Change in primary endpoint revealed significant improvement in the low-level light therapy group compared to the placebo or the nothing treatment. Here you go. No serious adverse events were observed. The use of low-level light therapy for the treatment of dry eye and meibomian gland dysfunction, that's what produces the tears, so to speak, appears to be safe and effective. Now, one of the most exciting areas of research is in macular degeneration, because as we age, more and more people get age-related macular degeneration, and it affects 20 million Americans. That's common. This is already approved. Red light is in Europe for these applications, but let's look at this study here. Here you see on macular degeneration, red light therapy is a therapeutic procedure that uses red or near infrared. Red we know as 630, near infrared we know as 830 in the aesthetic world mainly, to stimulate growth and healing of tissue.
Typically, a doctor may use red light therapy. Look at this. We know it for wound healing, calm acne, reduce arthritis. That's why so many people use these and these flexible masks, of course, on the body. However, research suggests that red light therapy could help slow down the effects of age-related macular degeneration by increasing the function of the mitochondria. The same thing that we're using it for the mitochondria for the fibroblasts. Fibroblasts produce collagen and elastin. And here it is. Research suggests that red light therapy in this here purple zone is a safe, non-invasive form of treatment for AMD. Red light therapy is different from therapeutic laser photocoagulation. That's much higher powered than photocoagulation. That's using heat to coagulate. And they say the photocoagulation, which a doctor may use to treat active AMD lesions in the retina. So two totally different things. This is using low-level red light therapy, like a 630 and 830. And each particular study goes through their wavelengths and the energy used for their low light therapy. Here's one such study, Clinical Ophthalmology 2021. So this is new stuff. Photobiomodulation, which is what we're doing in aesthetics for the skin. Therapy for age-related macular degeneration for diabetic retinopathy. So also not only macular degeneration, but diabetic retinopathy as well. You can see when we're dealing with making the mitochondria more powerful, the ATP, the energy storehouse of the cell. This is why red light therapy sounds too good to be true, because it works on every cell that you're exposing the light to. And by increasing the wavelength, we can go deeper. So you can get superficial, mid, and deep. So that's why this red light therapy is so powerful and used in more and more aspects and facets of medicine. We're evaluating the efficacy, the effectiveness of LLT, low-level light therapy, with near-infrared emitting diodes. That's near-infrared. Now, in an LED mask like mine, near-infrared is going to be 830 nanometers. You can't see that with the visible eye. Now, here's the dose. Twice a week for 3 weeks for a total of 6 treatment sessions.
Now, many of you may have experienced a sty, or what seems to you like a pimple at the edge of the eye or on the inside of the eye. We often refer to these as chalazions is the term, but a sty is what most people call it. I actually did a video where I got a sty and it inflamed the filler that I had left over under my eye from 8 or 9 years ago. I'll put that video up here and more importantly at the end if you want to watch that. But styes are not innocuous. They lead to other problems. Let's look at this study here.
So here's one study, Clinical Ophthalmology, low-level light therapy, and they used LEDs at 630. We'll go to that page in a minute. I'll double check that, but I believe that's what they used to evaluate the effects of low-level light therapy, the LEDs, on resolution of the chalazia. Well, what's that? Okay, well, here's the plain language summary for us. A chalazion is an eyelid cyst that you guys will know that gives the eyelid a swollen appearance. And of course, it looks like this. What do people normally use? Of course, warm compresses or drugs like doxycycline. Sometimes you have to kind of place an opening and drain it, but that's not that common. And look here, low-level light therapy. It's a matrix of LEDs with a wavelength. Look at this, 633 plus or minus 10. They're usually now plus or minus 5, like my mask is 630 plus or minus 5. That's normal, nanometers in wavelength. The emission power of 100 milliwatts per centimeter squared in a 15-minute treatment, and some of them had up to 2 treatments. And here you go, results. Total of 26 eyes is what they treated, the 15 minutes that we talked about. Resolution was noted from 3 days to 1 month post-treatment. And this was a retrospective chart review, by the way. That's why you have that variable. With a second treatment, they resolved in 92% of eyes. The conclusion, the use of low-level light therapy, which was LED at 633 in this case, for the treatment of chalazia, appears to be beneficial in patients who have even failed topical or systemic, typically you're using doxycycline, who failed systemic therapy, significantly reducing the likelihood of requiring surgical intervention. So these were the more resistant cases.
So you see there's ongoing research for red light in the eyes. Now, I actually designed my mask with more LEDs underneath the eye and around the lips, and of course for the jowls. So I actually have mine target the eye, meaning the skin around the eye. So keeping the eye closed while this mask is on gives you the benefit of treating the upper and lower lid and the under eye, and that's the way it's designed. Many masks, like mine, will come with a little gasket that fits around the eye so you don't get light into the eye. Using this gasket avoids getting any light into the eye or around the upper or lower lids. Here's some footage from an unboxing video that I have about my LED mask, so you can see when I'm talking about eye protection or gaskets on these masks to protect the eye but still allow you to get the benefits of red light around the eye. These are what I'm talking about. And you can see the extra LEDs on this mask under the eyes, above the lip, and of course you have that jowl strap there that tightens up to treat the jowls, but this keeps the eyes safe. And most people with sensitive eyes to light don't want to get any amount of light into their eyes, they can use these gaskets, and that's what I recommend for most people. It's important to realize a lot of these studies and data, well, they're newer. People are living longer. We're finding out so many of the benefits of red light. So if in doubt, of course, we don't want to get red light into the eyes. And for red light therapy in the studies, they use specific devices built for the eyes. Now, what do? I personally like the meditative effects of 10 minutes 3 times a week where I don't have to think about anything. So I close my eyes while I'm treating with the mask because I want to treat the upper and the lower lids. I do often, a couple times a week, put the mask on and I do chores. I do things around the house. Maybe I'm watching TV, cooking, getting ready for something. I will then keep my eyes open. You can choose to wear gaskets or not. I personally don't. For the couple times a week that I use it and I'm looking through it. Keep in mind, this mask is snug to your face. So you're not, when it's strapped up nice and tight, you're not getting direct high dose into the back of the eye. But definitely, I recommend closing the eyes and using the gaskets. Now, what are people doing that really scares me? Well, you know those light wands, the handheld ones, they mostly are around 40 milliwatts per centimeter squared in power for those people who geek out on the power output of these things. But what they're doing is they're taking them and they're putting them directly into their eye. They're shining them into the eye based on looking at these light studies for particularly macular degeneration and visual acuity. And I think that's very dangerous. These are not built to be shined into the eye. And in fact, in the USA, none of the devices are approved yet, but often we're behind other countries. You guys know I go to Europe a lot, and of course, red light is very common in Europe because they like natural treatments, and that's where I learned a lot about how people use it for under the eye, around the eye, and in the eye, particularly for these new indications. Now, also in Asia, people use the mask in the morning because you do get a photoprotective effect, meaning the inflammation that the sun creates, there's good data to say that you can negate some of the inflammation and the photo damage by using this in the morning before you start your day and you get sun exposure. It does not replace sunscreen, but it's a nice additive benefit. And if you're not getting sun during the day, that even helps you more because a lot of people don't want to put on sunscreen, obviously, if you're not getting sunlight, but any little bit you get, this mask can be photoprotective. And I have data and studies on that. I'll put a link to that photoprotective study below. So you never want to use your LED aesthetic mask as a substitute to treat your inner eye problems like macular degeneration, or particularly people asking me about acuity. You're now going to want to watch this video all about melasma and brown spots in red light, and one down here on the fat pads and how red light LED mask affects your fat pads, because that's the holy grail of staying young looking. Stay tuned here. Keep your skin and body beautiful, healthy, and vibrant.